Hello students, in this part we will discuss some more sexually transmitted disease such as syphilis, AIDS, genital warts and genital herpes. First we will discuss on syphilis. Syphilis, this disorder may spread from an affected person to a healthy person. Its agent is a bacteria called Treponema pallidum. Syphilis, its agent is bacterium Treponema pallidum. Bacterium Treponema pallidum. It is transmitted through sexual contact or exchange of blood. Maybe this disorder may be spread from affected female to its fetus through placenta. Exchange of blood or through the placenta to a fetus. During the primary stage, it means at the initial stage, there are some short sensors like structures can be seen. Primary stage, the chief symptoms is painless, open shore means just like as a फोड़े की भांति बन जाता है. Open shore, cancre, chancre, CHANCRE. Slowly it remains a long time. Then the secondary and tertiary stage may be occurred. Skin rashes start. Slowly, skin rash. It means dry skin with the red spot. Fever and aches in joints and muscles. Aches means pain रहना. Aches in joints and muscles. This bacteria may also affect the nervous system, which is known as neurosyphilis. May also affect the nervous system. Then it is called neurosyphilis. These are the symptoms and the agent. Now, how this disorder can be treated? Treatment. It can be treated with antibiotic penicillin. It means if a person is suffering from syphilis, then those type of person are given an antibiotic called penicillin. Or if a person is suffering from neurosyphilis may also be successfully treated. But that is not sure every time. But the prognosis diagnosis means after detection of the symptom of any disease, the doctor diagnoses the disorders. And prognosis means the symptoms are be seen that should be resembled. But the prognosis for other is very poor because at initial stage there are no symptoms can be seen. Clear? This is the syphilis. And next disorder is AIDS. AIDS, acquired immunodeficiency syndrome. This disorder may occur due to a virus called HIV. This virus is also known as retrovirus, ribovirus, because the genetic material of this virus is RNA. Agent, HIV virus means human immunodeficiency virus. About the AIDS, we have already discussed in the human health and disease, which type of virus and how is the structure of a virus can be contained. Only in this part we will discuss what is AIDS and how it may affect the body as well as what is the treatment. symptom. It can get transmitted through blood transfusion. Means a person which is suffering from AIDS and its blood is his or her blood transfused to a healthy person, then the healthy person also suffering from AIDS, because the virus from the blood enters into the healthy person through blood, and also by sexual contact, between males and females. There are many sexual contacts, means oral sex as well as anal intercourse and vaginal. Through vaginal, oral and anal intercourse, means this disorder may spread from an affected person to a healthy person by sexual contact, such like as vaginal intercourse, anal intercourse, oral intercourse, as well as with blood transfusion. Result of मतलब सेक्सुअल कॉन्टैक्ट की तरह या ब्लड ट्रांसफ्यूजन की तरह, जिसके कारण से ये वायरस बॉडी के अंदर एंट्री कर जाता है. उसका रिजल्ट क्या होता है? रिजल्ट ऑफ एंट्री ऑफ दिस वायरस इन बॉडी कोलैप्स of the immune system, the disease resistance power of the body, and the person becomes susceptible. It means more risk at the exposure when he or she exposed in the outer side. The small microbes, when they enter the body of that affected person, that may also cause some more disorder. Person becomes susceptible to infection. These are the symptoms. And the treatment, there is no fully cure. There is no fully treatment of this disorder, but it can be stopped the growth of the viruses inside the body. The first and still most commonly used drug to treat AIDS is AZT, azithromycin. This drugs cannot be fully treated the person who is suffering from AIDS, but the growth of the virus may be stopped. Or retrovir, means azithromycin as well as retrovir. Some other drugs are also used, such as DDI, D-deoxyionosine, and next one is DDC, D-deoxycytidine. This is the full form of DDC. And next one is D4T, that is known as stabudine or Zerit. These are the drugs which can be stopped the growth of the virus, but there is no fully treatment of this disorder. And the next disorder is genital herpes. Genital herpes, its agent is also a virus. Agent type 2 herpes simplex virus. It is also known as HSV2, means type 2 टाइप का वायरस, जिसका फुल फॉर्म है herpes simplex virus, HSV. Symptom, क्या symptom होते हैं? If the person is suffering from genital herpes, there are some watery blisters, मतलब पानी की फुंसियां हो जाती हैं. Watery blisters on penis glands in the male, or on the vulva of female. These blisters continuously appear, disappear. It remains continuously. Blisters disappear or reappear in most patients. if the blister break down, means a woman she is pregnant, and at the time of parturition the blister present in the vulva. During the parturition, if the blister break down, the liquid mixed with the infected the newborn, the death of it is the cause of death of the newborn, as well as it may cause very dangerous disease, means chronic disease. If the blister break down during parturition, it can affect the newborn. And may also cause of death. Sometimes it may becomes very dangerous situation. It means the newborn baby may be in dangerous situation. He is or she is suffering from any chronic disease. And last one is genital warts. Genital warts. What do you understand by warts? Warts means massa. Its agent is also a virus. कौन सा एजेंट है? ह्यूमन पैपिलोमा वायरस. You can also say that HPV, human papilloma virus. Symptoms, warts produce हो जाते हैं. Warts produce in cervix. Mostly this disorder may be spread in female. In sometimes in males, such like as the warts produced at the penile sucker. Warts produced in cervix, and these are the main reason of the these are the main cause of the cervical cancers in the female. These are the cause of cervical cancer. Clear? How this type of disorder can be treated? Treatment: cryotherapy with liquid nitrogen के साथ क्रायोथेरेपी की जाए, और अल्फा इंटरफेरोन, use of alpha interferons as we have discussed in biotech. Pap smear, Pap smear. Pap, why it is known as Pap? Pap is a multiple test on the basis of project. What are the project? Means prognosis. And it was proposed by Papanicolaou, is Dr. Papanicolaou. On the name of that honor, name the honor of that doctor, it is known as Pap smear. Pap smear is done. Pap smear means Pap test. Smear means test. Is done as screening test for cervical cancer. Means there are many project tests which are testing screening test during the cervix. If the female is suffering from cervical cancer, then those tests which are based to detect the disorder may present or not, those all tests are known as Pap smear or Pap test. Why these are called Pap tests? Because this was observed by a doctor called Papanicolaou. In the name of honor of doctor, this is known as Pap test as well as Pap smear. Clear? These are the disorders which spread from an affected person to healthy person by the sexual contact, so they are known as STDs, sexually transmitted disease.